7 medieval medicine techniques that are making a comeback for good reason. Picture a medieval physician. You're probably imagining some quack with leeches and rusty saws, right? Bloodletting for headaches, drilling holes in skulls to release evil spirits. The kind of medical care that makes you grateful for modern hospitals. Here's the thing, though. The FDA just approved 2 medieval treatments in 2004, not as historical curiosities, as legitimate medical devices for actual hospital use. Major medical centers from Johns Hopkins to UCLA are bringing back techniques that haven't been mainstream since the 1400s, and patients are getting better results than with modern alternatives. I'm not talking about essential oils or crystals. I'm talking about peer-reviewed, double-blind studies published in journals like The Lancet and JAMA showing that certain medieval methods outperform 21st century pharmaceuticals and surgery. Techniques that got laughed out of medicine schools for over a century are now being taught again because doctors ran out of options and discovered something uncomfortable. Sometimes the old way actually worked better. Let's talk about 7 medieval medical techniques making serious comebacks in modern hospitals. And before you dismiss this as nostalgia, every single one of these has hard science backing it up now. The medieval physicians who used them didn't understand why they worked, but they worked anyway. Maggot therapy. You've got a diabetic ulcer on your foot. It's infected. Antibiotics aren't touching it. The tissue is dying, turning black, and your doctor is mentioning amputation. This happens to about 85,000 Americans every year, by the way. Diabetic foot ulcers are brutal. Now imagine your doctor suggests putting live maggots in your wound. You'd think they lost their license, right? Except in 2004, the FDA approved maggot therapy as a legitimate medical device. Not alternative medicine, not experimental. A recognized treatment that hospitals can bill insurance for. And it works better than the modern alternatives in specific situations. Here's what medieval barber surgeons figured out through pure observation. When soldiers died on battlefields and their wounds got infested with maggots, those wounds were often cleaner than the ones that stayed maggot-free. The flesh around maggot-infested wounds looked healthier, less gangrene, less infection spreading. They didn't know why. They just noticed the pattern and started intentionally introducing maggots to wounds that weren't healing. It became standard practice in medieval surgery, continued through the Renaissance, and was still being used in the American Civil War and World War I. Then antibiotics showed up. Penicillin, sulfa drugs, modern medicine. Maggots got dismissed as primitive and disgusting. Why would you use bugs when you had pills? But here's where it gets interesting. Antibiotic-resistant bacteria started appearing, MRSA, VRE, bacterial strains that laugh at our strongest drugs. Suddenly, doctors had patients with infections that wouldn't respond to anything in the pharmaceutical toolkit, diabetic ulcers that wouldn't heal, pressure sores eating through tissue, necrotizing fasciitis, turning people's limbs into dead meat. So in the 1990s, some desperate doctors started looking backward. What did we use before antibiotics? And they rediscovered maggots. The science behind it is actually elegant. Medical maggots, specifically sterile-bred larvae of the green bottlefly, do 3 things simultaneously. First, they only eat dead tissue. They physically cannot digest living flesh because they lack the enzymes, so they naturally debride the wound, removing the necrotic tissue that's feeding bacterial growth and preventing healing. Second, they secrete antimicrobial compounds. Their digestive enzymes break down bacterial cell walls. Studies show maggot secretions are effective against MRSA, which is kind of a big deal when your antibiotics have stopped working. Third, they stimulate healing. The mechanical action of maggots moving around in the wound increases blood flow to the area. Their secretions contain growth factors that promote tissue regeneration. Wounds treated with maggots often heal faster than wounds treated with conventional debridement. A 2009 study in the British Medical Journal compared maggot therapy to standard surgical debridement for leg ulcers. The maggot-treated wounds were completely debrided in less time and showed faster healing rates. A 2012 study found maggot therapy more cost-effective than standard care for chronic wounds. Modern maggot therapy uses sterile laboratory-raised larvae. They arrive at hospitals in little containers, prescribed like any other medical treatment. Doctors apply them to the wound, cover it with a special dressing that lets the maggots breathe but keeps them contained, and leave them for a few days. The maggots do their work. Then they're removed and disposed of. It's not pretty. Patients have to get over the psychological barrier of bugs eating their dead flesh. But when the alternative is losing your foot, most people get over it pretty quickly. Hundreds of medical centers worldwide now offer maggot therapy. It's particularly common in wound care clinics that deal with chronic, non-healing wounds. The technique that medieval barber surgeons used because they had no other options turns out to be genuinely superior for certain applications in the antibiotic age. The kicker? Medieval physicians had no idea about bacteria, enzymes, or tissue regeneration. They just knew maggots cleaned wounds better than anything else they had. Pure empirical observation leading to a technique that modern science eventually validated 8 centuries later. Leech therapy? Let's stay with the creepy crawlies for a minute. Medieval bloodletting gets mocked constantly, and rightfully so for most of it. Draining blood to balance the 4 humors was nonsense that probably killed more people than it helped. George Washington almost certainly died because his doctors bled him to death trying to cure a throat infection. But here's what nobody tells you. Medieval physicians used leeches for more than just bloodletting. They noticed leeches were particularly good at reducing swelling and improving blood flow in specific situations, especially in appendages, fingers, toes, areas with restricted circulation. They were onto something. Modern microsurgery has a problem. When surgeons reattach a severed finger or perform reconstructive surgery, they're connecting tiny blood vessels smaller than a millimeter. The arterial blood flows in just fine because hearts pump hard. But the venous blood, the blood that's supposed to flow back out, often gets congested. The veins are harder to reconnect perfectly. This creates venous congestion. Blood flows into the reattached tissue but can't flow out. The tissue swells with excess blood. Pressure builds. Small vessels rupture. The tissue dies. All that delicate microsurgery fails because of plumbing problems. Surgeons tried everything. Blood thinners, careful drainage, special surgical techniques. Nothing worked as well as what they needed, which was continuous gentle removal of excess blood until the venous connections healed enough to function normally. Then somebody remembered leeches. The FDA approved medicinal leeches in 2004, same year as maggots, specifically the species Hirudo medicinalis, raised in sterile conditions and certified as medical devices. Major hospitals started keeping them on hand for plastic surgery and microsurgery departments. Here's why leeches work so well for this specific problem. When a leech attaches and feeds, it doesn't just suck blood. It injects a whole cocktail of bioactive compounds, hirudine, a powerful anticoagulant that prevents clotting, vasodilators that increase blood flow, anesthetics so you barely feel the bite. One leech can consume up to 5 times its body weight in blood. Then, after it detaches, the anticoagulants it injected keep the wound bleeding for hours. So one leech effectively drains blood from the congested tissue for 6 to 12 hours after it's removed. For a surgeon dealing with venous congestion after reattaching a finger, that's perfect. Apply leeches to the reattached digit. They drain the excess blood. Keep the tissue viable. Reapply new leeches every 12 hours until the venous connections heal enough to function on their own. Studies show leech therapy increases the success rate of microsurgical reattachment from about 60% to over 80%. That's the difference between keeping your finger and losing it. The technique has expanded beyond just reattachment surgery. Plastic surgeons use leeches after breast reconstruction to reduce swelling and prevent tissue death in skin grafts. They're used in scalp reattachment, ear reconstruction. Any situation where surgeons need to reduce venous congestion while delicate vessels heal. Walk into the plastic surgery unit at Johns Hopkins or the Mayo Clinic and you'll find medical leeches in special storage containers. Prescribed. Applied by trained nurses. Billed to insurance. The same creature medieval physicians used 1,000 years ago, doing the exact same job because modern medicine couldn't engineer anything better for that specific application. Medieval doctors didn't understand anticoagulants or venous drainage. They just observed that leeches reduce dangerous swelling in injured appendages, and they were right. Medical grade honey. Your grandmother probably told you to put honey on cuts. You probably ignored her because you had neosporin. Turns out Grandma was channeling medieval medicine, and she was right. Honey shows up in medical texts from ancient Egypt through medieval Europe as a primary wound treatment. The Edwin Smith Papyrus from 1600 BCE mentions it. Hippocrates wrote about it. Medieval battlefield surgeons carried it. It was the go-to treatment for open wounds until modern antibiotics replaced it. Then it got dismissed as folk remedy. Old wives' tale. Use real medicine, not food. Except the infections kept coming back. Antibiotic resistance, MRSA. Hospital-acquired infections that wouldn't respond to standard treatments. And desperate wound care specialists started looking at anything that might work. Medical-grade honey is now FDA approved for wound care, not the stuff from your grocery store. Specialized honey with standardized antibacterial properties, sterilized with gamma radiation to kill any bacterial spores, applied in measured doses as a legitimate medical treatment. The most studied type is Manuka honey from New Zealand. But other medical-grade honeys work too. They're showing up in hospitals worldwide as wound dressings for burns, surgical wounds, and chronic ulcers. Here's why honey works. It's not just one mechanism, it's like 6 different antibacterial mechanisms, all working simultaneously. First, honey is hygroscopic. It sucks water out of bacterial cells through osmosis, dehydrating them to death. The high sugar concentration creates an environment where bacteria physically cannot maintain their water balance. They dry out and die. Second, honey is acidic, with a pH between 3.2 and 4.5. Most bacteria prefer neutral environments. The acidity disrupts their metabolism and growth. Third, when honey comes in contact with wound fluid, it produces hydrogen peroxide. Not enough to damage tissue, but enough to kill bacteria. Medieval physicians had no idea this was happening. They just saw that honey-treated wounds didn't get infected. Fourth, honey contains antimicrobial peptides called defensins. These are produced by bees and have direct antibacterial effects. Different honeys have different peptide profiles, which is why medical-grade honey uses specific types with standardized antibacterial properties. Fifth, honey creates a physical barrier between the wound and the environment. It's sticky. It seals. It keeps external contaminants out while maintaining a moist environment that promotes healing. Sixth, honey has anti-inflammatory properties that reduce swelling and pain. It promotes faster tissue regeneration and reduces scarring. The clinical evidence is solid. A 2015 Cochrane review, which is basically the gold standard for medical evidence, analyzed 26 trials involving over 3,000 patients. Honey showed significant benefits for treating burns and partial thickness wounds compared to conventional dressings. Another study in the Journal of Wound Care found honey effective against MRSA in chronic wounds that hadn't responded to antibiotics. Hospitals now stock medical-grade honey dressings alongside traditional wound care supplies. Burn units use it. Diabetic wound clinics use it. It's particularly valuable for wounds that aren't responding to standard treatment. The technique is exactly what medieval physicians practiced. Clean the wound. Apply honey. Cover it. Change the dressing regularly. The only difference is modern doctors understand the biochemistry behind why it works. Medieval physicians just knew honey kept wounds clean and helped them heal. They were empirically correct even though their theoretical understanding of humors and miasmas was complete nonsense. Sometimes observation beats theory. Therapeutic fasting. Medieval physicians loved fasting, not for religious reasons, though that was part of it. They prescribed fasting for digestive problems, fevers, and general illness. The logic was that digestion taxed the body, so stopping it freed up energy for healing. Modern medicine dismissed this as superstition. You're sick? You need nutrition. Eat. Build strength. Fasting is what primitive people did because they didn't understand metabolism. Then researchers started actually studying fasting, and they found something medieval physicians stumbled onto without understanding the mechanisms. Fasting triggers autophagy. That's the process where cells break down and recycle damaged components. Think of it as cellular housekeeping. Your cells are constantly accumulating damaged proteins, dysfunctional organelles, and other molecular garbage. Autophagy is the cleanup crew. When you're constantly eating, especially carbohydrates that spike insulin, autophagy slows down. Cells are busy processing nutrients. They don't have time for deep cleaning. But when you fast, insulin drops, and autophagy kicks into high gear. The Japanese researcher Yoshinori Osumi won the Nobel Prize in 2016 for discovering the mechanisms of autophagy. His work showed that fasting is one of the most powerful triggers. When cells don't have external nutrients coming in, they start breaking down internal components for energy, and they're selective about it. They target damaged and dysfunctional parts first. This has huge implications for disease. Autophagy helps prevent cancer by removing damaged cellular components before they can become malignant. It reduces inflammation by clearing out inflammatory signaling molecules. It protects neurons, which is why fasting shows promise for preventing Alzheimer's and Parkinson's. Studies on intermittent fasting, which is basically a modern structured version of medieval fasting practices, show benefits across multiple systems. A 2019 study in the New England Journal of Medicine reviewed the evidence and found intermittent fasting improves markers for cardiovascular disease, reduces inflammation, lowers cancer risk, and improves cognitive function. A 2017 study showed fasting before chemotherapy protected normal cells while making cancer cells more vulnerable to treatment. Fasting essentially stresses cells, and healthy cells respond by becoming more resilient, while damaged cells can't adapt as well. Medieval physicians prescribed fasting for infections and fevers. Modern research shows fasting increases white blood cell production and immune system efficiency. A 2014 study at USC found that fasting for just 3 days can regenerate the entire immune system by triggering stem cells to create new white blood cells. Now you've got major medical centers studying therapeutic fasting for everything from diabetes to autoimmune diseases. The Buchinger Clinic in Germany has been using therapeutic fasting protocols since the 1950s, treating over 2,000 patients. Their data shows significant improvements in metabolic disorders, hypertension, and chronic inflammatory conditions. Here's the kicker. Medieval physicians thought fasting balanced the humors and cleared bad vapors from the blood. Complete nonsense. But the practice worked because it triggered real cellular processes that improve health. They had the right intervention for completely wrong reasons. Modern science figured out the actual mechanisms, and now therapeutic fasting is being studied at Harvard, Johns Hopkins, and the National Institute on Aging. The medieval practice dismissed as primitive is being rehabilitated as cutting-edge preventive medicine. The monasteries had it right with their fasting schedules, not because God commanded it, because periodic fasting actually does make you healthier. Herbal medicine. Medieval herbalists get portrayed as superstitious mystics, grinding up plants based on whether they looked like body parts, totally unscientific. Except here's a fun fact. About 40% of modern pharmaceuticals are derived directly from plant compounds that medieval herbalists used. They didn't understand the chemistry, but they correctly identified which plants treated which conditions through centuries of trial and error. Take willow bark. Medieval physicians prescribed it for pain and fever. They made teas and poultices from it. It was one of their most common remedies. Willow bark contains salicin. When you ingest salicin, your body converts it to salicylic acid, which is the active ingredient in aspirin. Bayer didn't invent aspirin. They synthesized and standardized a compound that medieval herbalists had been using for centuries, or foxglove. Medieval herbalists used it carefully for heart conditions. They knew it was dangerous. Too much killed you. But the right amount helped people with irregular heartbeats and fluid retention. Modern medicine isolated digitalis from foxglove. It's still used in cardiac medicine today for heart failure and atrial fibrillation. The medieval herbalists were literally prescribing the same active compound, just in plant form with less precise dosing. Opium poppies for pain. Morphine and codeine come from those. Cinchona bark for fevers. That's where quinine comes from, which treated malaria and is still used for severe cases resistant to modern anti-malarials. Artemisia annua, sweet wormwood, used in traditional medicine for fevers. Modern scientists extracted artemisinin from it, which is now a first-line treatment for malaria and won a Nobel Prize in 2015. The list goes on. Taxol from yew trees for cancer. Atropine from deadly nightshade for various medical applications. Ephedrine from ephedra for asthma. Medieval herbalists weren't randomly guessing. They were running empirical trials across generations. If a plant helped people recover, they kept using it and refined the preparation. If it killed people more often than it helped, they stopped. It was crude clinical research without the scientific method, but it worked. What's happening now is a rehabilitation of herbal medicine, but with scientific rigor. Researchers are going through medieval herbals and traditional medicine texts, isolating active compounds, testing them in controlled studies, and developing new pharmaceuticals. The cancer drug Taxol was discovered because researchers investigated why Native Americans and later European herbalists used Pacific yew bark. The compound artemisinin was found because Chinese scientists studied ancient texts about treating fevers with sweet wormwood. Modern herbalism is also making a comeback, not as an alternative to medicine, but as complementary treatment. Clinical herbalists work alongside doctors, using standardized plant extracts with known chemical profiles. They're not prescribing random weeds. They're using the same plants medieval herbalists used, but with modern quality control and dosing precision. St. John's wort for mild depression, ginger for nausea, valerian for sleep. These aren't New Age inventions. They're medieval remedies that have been validated by modern clinical trials and are now recommended by physicians for appropriate cases. The difference is we understand why they work now. Medieval herbalists knew willow bark helped with pain. We know it's because of salicin converting to salicylic acid, which inhibits cyclooxygenase enzymes involved in inflammation and pain signaling. Same plant, same effect. Better understanding? Medieval herbalism failed when it relied on symbolic thinking, like using plants that looked like body parts based on the doctrine of signatures. That was nonsense. But when medieval herbalists observed actual clinical effects and kept using plants that worked, they were doing valid medicine with the tools they had. Modern pharmacology is basically medieval herbalism with better technology. Bone setting. Medieval bone setters were separate from physicians. They were craftspeople, often passed skills down through families. They manually manipulated broken bones, dislocated joints, and spinal problems. Physicians looked down on them. Manual labor. Not learned medicine. Just tradecraft. But people kept going to bone setters because they got results. A good bone setter could fix a dislocated shoulder in minutes, set a broken bone so it healed straight. relieve chronic back pain with manual manipulation. This tradition continued outside mainstream medicine for centuries. In the UK, bone setters were common into the 1800s. In the US, they evolved into osteopaths and chiropractors. The techniques got formalized, theorized, and either accepted into mainstream medicine or pushed into alternative medicine depending on the country and political factors. Here's what modern medicine is rediscovering. Manual therapy works for specific conditions. Not all conditions, not as a cure-all, but for musculoskeletal problems, skilled manual manipulation often works as well as or better than drugs and surgery. Physical therapy now includes manual therapy techniques that are essentially medieval bone setting, joint mobilization, soft tissue manipulation, spinal manipulation. These are evidence-based treatments covered by insurance and taught in medical schools. A 2017 study in JAMA compared spinal manipulation to usual medical care for acute low back pain. The manipulation group had better outcomes with less medication use. A 2012 Cochrane review found manual therapy effective for neck pain. Osteopathic medicine, which evolved directly from bone-setting traditions, is now fully integrated into mainstream medicine. Osteopathic physicians are licensed doctors who can prescribe medications and perform surgery, but they also learn manipulative techniques. About 25% of U.S. medical students now attend osteopathic schools. The techniques are the same as what medieval bone setters practiced: high-velocity, low-amplitude manipulation for joint dysfunction, muscle energy techniques, myofascial release. The theoretical framework changed. Modern practitioners talk about biomechanics and neurology instead of moving bones back into place. But the hands-on techniques are remarkably similar. What medieval bone setters understood intuitively is that the body's structure affects its function. If joints aren't moving properly, it causes pain and dysfunction. Manual manipulation can restore proper motion and relieve symptoms. They didn't understand the neurology. They didn't know about proprioception or pain-gating mechanisms. They just knew that manipulating joints in specific ways made people feel better and function better. And they were right. Modern manual therapy is more refined. Better anatomical knowledge. Better understanding of contraindications. But the core idea that skilled hands can fix mechanical problems in the body is validated medieval bone setting. The medieval craftspeople who set bones and manipulated joints weren't superstitious. They were empirical. They developed techniques that worked, taught them carefully, and refined them over generations. Modern medicine initially dismissed them, then slowly realized they were onto something. Cauterization. This one's brutal. But it's also fascinating because it's a perfect example of a medieval technique that modern medicine initially abandoned, then brought back in a more refined form. Medieval surgeons used red-hot iron to seal wounds and stop bleeding. They'd heat metal instruments in fire and press them directly onto bleeding tissue. It burned the flesh, sealed the blood vessels, and prevented hemorrhage. It was excruciatingly painful. It often caused severe tissue damage. But it kept people from bleeding to death, which was the main cause of death in traumatic injuries. Modern surgery developed much better methods: surgical clamps, sutures, electrocautery that uses electrical current instead of hot iron. Medieval cauterization got filed away as primitive brutality. But here's where it gets interesting. The principle behind cauterization, using heat to seal tissue, never went away. It just got more sophisticated. Electrocautery, invented in the 1920s, uses high-frequency electrical current to heat tissue and seal blood vessels. It's standard in every operating room. Surgeons use it constantly during procedures to control bleeding. It's faster and more precise than tying off individual blood vessels. Laser surgery uses focused light energy to cut and cauterize tissue simultaneously. Same principle as medieval hot iron. Different energy source. Better control. Radiofrequency ablation treats certain tumors and arrhythmias, by using radio waves to heat and destroy targeted tissue. It's controlled cauterization. Even more interesting is the comeback of actual thermal cauterization in specific situations. In remote medicine, wilderness medicine, and battlefield trauma care, heated instruments are still used when modern equipment isn't available. The U.S. military studied historical cauterization techniques for combat situations, where soldiers might need to self-treat severe bleeding without access to surgical equipment. They found that controlled application of heat to bleeding wounds can be life-saving when you don't have other options. Some traditional healers in developing countries never stopped using cauterization. And medical anthropologists studying their techniques found they'd refined the method considerably. They used specific temperatures, specific application times, and herbal preparations that reduce scarring and infection risk. It's not random branding. It's sophisticated empirical medicine. A 2010 study published in the Journal of Emergency Medicine examined thermal cauterization for severe bleeding in austere environments. The conclusion was that while modern hemostatic agents are preferable, controlled cauterization remains a viable backup method when nothing else is available. What medieval surgeons understood is that heat seals tissue. Crude? Yes. Painful? Absolutely. But it works when the alternative is bleeding to death. Modern medicine refined the concept with electricity and lasers. But the fundamental principle that tissue responds to heat by sealing, and that this can control bleeding, hasn't changed. Medieval cauterization was the best they had. Modern cauterization is exponentially better, but it's still cauterization. Same concept, better execution. Conclusion. So what's the pattern here? Medieval medicine got a lot wrong. The four humors theory was nonsense. Bloodletting for most conditions killed people. Astrology-based diagnosis was superstition. Trepanning to release demons was horrific. But buried in all that wrong theory were techniques that actually worked. And medieval physicians kept using them because they got results, even though they couldn't explain why. Maggots cleaned wounds. Leeches reduced dangerous swelling. Honey prevented infection. Fasting improved health. Certain plants treated specific conditions. Manual manipulation fixed mechanical problems. Heat sealed bleeding tissue. They worked then. They work now. The difference is we understand the mechanisms. Modern medicine's initial impulse was to reject everything from the past as primitive and unscientific. Progress meant replacing old methods with new ones. But that assumption led us to abandon techniques that were actually effective, just poorly understood. What we're seeing now is selective rehabilitation. Researchers are going through historical medical texts with modern scientific tools, testing what medieval physicians did, figuring out which techniques have valid mechanisms, refining and standardizing the ones that work, discarding the ones that don't. It's not about romanticizing the past. Medieval medicine killed plenty of people. Life expectancy was brutal. Infections that we cure with a week of antibiotics were death sentences. But dismissing everything from the past as ignorant superstition misses the fact that humans are excellent observers. Medieval physicians watched thousands of patients over centuries. They kept careful records. They noticed patterns. And when something worked consistently, they kept doing it. Sometimes they were right for wrong reasons. Sometimes they were right for reasons they couldn't explain. And sometimes they were just empirically correct about cause and effect, even if their theoretical framework was completely wrong. The lesson isn't medieval medicine was great. It's careful observation produces valid results even without understanding mechanisms. And modern science should test historical practices instead of assuming they're worthless. Every technique in this video was abandoned. Everyone came back because doctors got desperate, tried the old method, and it worked. That's a pattern worth paying attention to. We're probably missing other medieval techniques that actually work, things we dismissed that shouldn't have been. The smart move is systematic review of historical medicine with modern research standards. Test it. If it works, figure out why and refine it. If it doesn't, understand why it failed. Because sometimes the best path forward is looking backward. If you found these forgotten techniques valuable, hit the like button and subscribe to Medieval Over Modern for more discoveries about what we lost when we stopped looking backward. Drop a comment and let me know which technique surprised you most, or if you've experienced any of these treatments yourself. Share this with anyone interested in medicine, history, or understanding why some old methods turned out to be ahead of their time. And hey, if you're heading into surgery, maybe ask if they've got leeches on hand. You never know.